It is BBC Radio Norfolk bringing you all the big news stories for the county and beyond. We know that some schools have been opened up and the churches and cathedrals are going to open for some small get-togethers with social distancing as from Monday. But some of the county's dental practices have today begun seeing patients who are in most urgent need. It's been almost 3 months since dentists were stopped from working, leaving some people in agonising pain. Sanjay Shah is the Chief Executive of Together Dental, which has 7 practices across Norfolk, in Norwich, Great Yarmouth, Sheringham and Downham Market. I'm happy to say that Sanjay can join me on the line now. So it must be somewhat of a relief for you and your colleagues to be being able to get back to work now, Sanjay.
Yeah, and first of all, thank you very much for having me on the show. I mean, it is an absolute relief. That's what we've all signed up for as dental professionals, to help patients and treat patients. And we're really excited actually to be back. It's a very big step to be open after 2-3 months of closures.
Well, it must be an enormous backlog of patients wanting checkups, but I understand you're doing the urgent patients first of all. What sort of conditions and cases have you come across?
Well, the thing is, there is a massive backlog of patients, particularly in the Norfolk area, where particularly it's very difficult to find a dentist even at pre-COVID levels. So we were quite sort of inundated across the board, even pre-COVID. So we had a backlog even then. So now 2-3 months of not working, the backlog is pretty severe. And due to the sort of restrictions of policies and protocols and how we can actually operate, which we feel that hasn't really been communicated properly to the public. I think the announcement about a week ago indicated that all dental practice will be open as normal. It quite frankly is not that. We are only able to see patients that are in pain and discomfort, and that's where we're starting, of course. Those are the patients in most need, and then we'll move on to patients sort of midway through treatment, and then following on from that, hopefully as restrictions lift, we can move into more routine care. I guess the real difference is the backlog is going to continue because let's take, for example, a practice that we have in Norwich. It's a 7-surgery practice. We would typically see 150 to 200 patients in a day. We're going to be seeing about 2 handfuls, 5 to 10 patients a day at the moment.
Now, some other dentists have actually been telling us that they didn't feel there was enough notice from the government to actually open up today. So how did you manage all this?
Well, being a group of practices, so we do have the 7 practices in Norfolk that you mentioned, but we're a group of 34 sites, predominantly in the east of England, but we do have a few others scattered around the country. We've been working really hard, 24 hours a day behind the scenes, to almost try and preempt what might come into place, and that's why we've been not given enough guidance, quite frankly, from this country, and we've had to look abroad to see what's happening elsewhere. So we preempted a lot of the things that landed in our operating procedures that came through on Thursday afternoon. So that literally gave practices 1 working day to get everything up and running. So we were lucky that we have the manpower and resource to actually preempt, and we've been very proactive in that, and therefore we're in a position where we can open today. There is absolutely no way, it's impossible to sort of start on Thursday when you get your operating procedures and then be open today.
So presumably any dentist working now has to have the full PPE with the see-through face mask, the mouth mask and all of that?
Yeah, absolutely. PPE is the big 3-letter word now, isn't it? We're talking about PPE day in, day out. And PPE is broken up into 2 types of procedures for dentistry. There's aerosol-generating procedures and non-aerosol-generating procedures. So the aerosol-generating procedures are the ones that are deemed probably more likely to spread the virus, although there isn't a lot of evidence around this as of yet. But the amount of PPE required for those procedures is phenomenal. you may have seen us on the BBC today, but one of our dentists was dressed in full PPE. It's quite a scary sight. Now, I should tell patients not to be scared. Most people are scared of going to dentists. In normal circumstances, all that is there for their protection as well as ours.
Oh, well, I'm pleased things are starting to get moving. Just one more question. I know you said there's an enormous backlog, but would you have any idea at all when things will start getting back to normal again? Remind me.
Well, the thing that's holding us back the most is the really stringent protocols and procedures that we have in place. I mean, they are the most draconian, I would say, in all of Europe. And what that, the main thing that's stopping us from really working is what we call the fallow time, and that's the amount of time that we need to take in between procedures. So at the moment, even if you do a check-up properly, you will need to leave that room vacant for 1 hour before you can see patients again. So until we get to a point where government sort of alert levels drop and we can start reducing that fallow time, the backlog is just going to continue and continue. My guess is as good as any's, but I would say August, September time we may get a lift in government sort of alert levels for COVID, and therefore we can start reducing the amount of time that we have to leave in between appointments. But it may take another few months before we start clearing the backlog. So it might not be until sort of late part of this year to early in the new year where we start to see any signs of normality. The one thing I should point out here is, we've opened up in good faith. We haven't been provided with information or clarity around our funding mechanism for the additional PPE, which is actually costing us more than we actually sort of make. So we're operating at loss, and we're operating in good faith that NHS England will help us and support us in order to get through this. But if they don't, there will be many practices that will not be able to survive throughout this, and then we may never see dentistry like we did at pre-COVID levels ever again.
Yeah, no, just a slight aside as well, then I'll let you go because I'm guessing you're a busy man. I have noticed that the government takes its scientific advice from SAGE and other similar agencies and organisations, but I've noticed they're being selective about the advice they actually follow. Does that concern someone in your profession?
I think it's a difficult one, isn't it? Because no one's ever been in this situation before. So it would be wrong of me to judge what. I think everybody's trying to do the right thing, but as I pointed out before, I actually feel that with dentistry we've gone the other way. I think we've gone to a real extreme, put in real stringent protocols and measures. We've shut down dentistry for 2 to 3 months, almost deeming it a non-essential service. And you've seen what's sort of happened out there. People are having to pull their own teeth out, and that's an embarrassment for me as a dental profession that I can't, and our teams and colleagues can't treat these patients. Now, we're glad that we're sort of back in, but, if we compare to everywhere else in Europe, for example, Germany never closed. Dental practice always remained open. France went back 11th of May. So, and they're able to do every single procedure sort of out there. And, we do have the most stringent policies and procedures when it comes to dentistry in all of Europe, and probably even the whole world when we come to think of it.
Thanks very much for joining us. Really appreciate your time and trouble, and keep us posted any developments. Please do let us know.
No worries. Thank you for having me.
Good to speak to you. Thanks very much. Thanks.